you hurt your wrist though, putting together some IKEA furniture. So if you've ever had IKEA furniture, or actually everybody that buys furniture online now, you have to put it together.
Yeah.
There is no chance that furniture is coming put together, okay? So everybody's putting furniture together more now. Most people are buying it online, not everybody, but I certainly do. I'm waiting for a dining room table and I know I'm gonna have to put that thing together. So she was doing a lot of this action, right? Your right wrist or left? With her right wrist. So we're going to go ahead and show you how we treat wrist pain like that, an overuse injury, and check to see if she needs an adjustment in the wrist and or elbow. So let's have you start on your back. Take your thumb and bring it to your pinky and resist. Okay, now your thumb to your index finger and resist. Okay, good. Relax here. So I can feel her wrist was out of alignment in the carpal tunnel region. Do you get any numbness or tingling in your fingers? So if somebody has numbness or tingling into the palm or into the fingers in the morning when they wake up, or at night, or all day even, then it's the carpal tunnel region here. And oftentimes that tunnel needs to be enlarged. So we push some of the bones posterior typically to open up that tunnel. She's not having that issue. I actually did the opposite adjustment there where we flattened it a little bit. Now we're gonna check her elbow. So we have two bones that go into the elbow joint, the radial bone and then the ulnar bone. Both come into the elbow joint, the humerus, okay, which is one bone up here. So I'm gonna push in. I want you to resist me. Ready? 1, 2, 3. Keep your hand like that. 1, 2, 3, resist. Good. Any pain? And 1, 2, 3, resist. Any pain there? So where's most of your wrist pain? Right there. So what this tells me is
Goes into here.
into there. Okay.
Yeah.
Yeah. So it's just from this action, right? So we're gonna do a little bit of laser on her wrist, and that's gonna get rid of that pain. Again, it's all soft tissue for her. So adjusting isn't going to necessarily make her wrist pain go away because it's muscular, soft tissue. So we're just gonna go ahead and laser here for a couple of minutes, and we'll test the wrist. So which movement increased the pain? Back, going forward?
I guess anytime that I have to grip.
Anything you have to grip hurts?
Yeah.
Okay. And it hurts up in here?
No, it just hurts up to here, this side
there,
here.
okay.
But it hurts like the inside and sometimes the outside. So.
Okay.
But it's only happening like this is my second day with pain now.
Okay. And when did you put the stuff together?
2 days
2 days.
ago.
2 days ago. Yeah. Okay. So we're gonna nip this in the bud really quickly here with cold laser therapy. Cold laser therapy is really great for soft tissue injuries, especially injuries in the wrist and hand, because the wrist and hand is such a thin joint. The laser is able to penetrate through without any obstruction and target the tissues that it needs to. We're gonna go from the side here, and we don't have glasses on because we're not shining it in anybody's eye. This is a class 1A laser. Some are more detrimental to the eyes, some are less, but you don't want to shine a laser in someone's eye directly, any laser, especially one of these healthcare lasers, but even one of those little pen lasers. You don't want to do that to anybody, okay? But normally most people wear glasses. Again, this is a class 1A laser, safe, but we're not exactly staring into the light here. You can see I'm covering it with my hand. So what I'm gonna have you do is I'm gonna test your wrist, see how you feel. And this takes about 1.5 to 2 minutes. So the whole treatment here is about, give or take, 5 minutes. Laser treatment really depends on the strength of the laser. So there are 15 watt, 10 watt, 25 watt, 50 watt lasers. We have all ranges. We have 15 watt that we rent out. This particular laser right here is a 25 watt laser. And then our go-to laser, the small portable one, which is actually at my house right now, that one is a 50 watt that can be changed to a 25 watt, interchanges. Okay, now why don't you go ahead and grab my fingers and just grab onto and squeeze. How's that feel?
That's a big difference, yeah.
Big difference?
Yeah.
Okay.
I don't feel the pain up here like I usually would.
Yep. So we might have to do 1 or 2 more treatments on that, and that should be. Do you have any more furniture to put together?
In the future, not anytime soon, thank God.
Okay. So there you have it, folks. If you have tendonitis or an overuse injury, or soft tissue injury, cold laser therapy is the gold standard. It is really, really effective. It's safe, and you can't go wrong with cold laser therapy. If you have any questions about cold laser therapy, we rent them out here in the office to people in the local area, and it's affordable and effective. So thanks for tuning in. See you soon. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.